So welcome to our Focus Forum. Thank you for sharing your lunch hour with us. Our topic today is resilience and challenges of our immigrant and refugee community under COVID. I'm Rita Riker, President of the Board of Focus Greater Syracuse. I'm pleased to welcome you to our forum and delighted that our expert panelists can join us today. Haji Adan, Marwah Alobaidi, Felicien Seruhungu, and Felicia Castricone. They will be formally introduced in just a moment. Today's forum continues our series focused on how we in Central New York are coping with COVID-19. We're scheduled for an hour today, and we will be recording today's session. In fact, I believe the recording has already started. Our panelists will each present for about 5 minutes, followed by about 20 minutes of Q&A, where we will address as many of your questions as possible. Thank you to those who've already submitted questions. If you have a question for our panelists, please use the Q&A button at the bottom of your screen. Board member Brian Hope will be monitoring the Q&A. If you have trouble using Zoom online, please try dialing in using the alternate phone number and sign-in information included in your invitation. That information is also in the chat box. Now, I'm very pleased to introduce our moderator, Father Jim Matthews. Father Jim grew up in Central New York and has served in the Syracuse Diocese since his ordination into the priesthood. He is the longtime pastor of St. Lucy's Church in Syracuse. I think we just figured out 30 years. Focus is pleased to count Father Jim as one of our wisdom keepers, recognized for his dedication and efforts to improving life for all Syracuse residents, with a particular emphasis on the underserved. Father Jim?
Thank you, Rita. It's nice to be with you. Our community is really blessed today with some outstanding people who have shown great leadership during this time of the coronavirus. These very special people have set up within hours, when this pandemic first hit Syracuse, a 24/7 hotline in 20 plus different languages to assist our friends in taking all the necessary measures against the dangerous virus. And so these very special people, our immigrants and our refugees, have proved over the months their compliance with public health guidelines, which not only saved many lives, but also became a source of great pride in their community. And so it is with this honor for me to introduce to you our panelists who will share their stories and be available for any questions afterwards. And so today we're blessed to have with us Marwah Alobaidi. Marwah is the Associate Director for the Resettlement Services at the Interfaith Works Center for New Americans. She joined the IFW in 2011 while a student at Syracuse University. She graduated from Syracuse in 2013 with a degree in engineering, but her heart and her passion was in helping refugees get resettled and assist them in adjusting to their new life. Marwah came to the United States from Iraq in 2008 with her parents, and she settled in Syracuse with the help of Catholic Charities. Marwah is a mother to a 5-year-old girl and a 6-month baby boy. To Marwah, welcome. We'd also like to welcome, who is paired with Marwah, Felicien Seruhungu. Felicien is a caseworker for Interfaith Works, where he has served for the past 4 years. He is originally from the Democratic Republic of the Congo. Felicien lived in a refugee camp for 5 years, and he survived the Gatumbo genocide, which took place in 2004. Felicien came to the United States in 2009. He is married with 5 children, 3 boys and 2 girls. He loves sports, especially soccer. To Felicien, we say welcome. Our third panelist is Felicia Castricone. Felicia is a program director for the Refugee Resettlement Services for Catholic Charities. Felicia came to Syracuse in 1981 as a Jesuit volunteer. First, she taught preschool and running a teenage program in Syracuse on the near west side. In 1988, Felicia became director of the North Side CYO, where she welcomed the opportunity to work with many different groups. This would include the Vietnamese, the Bosnians, the Kosovars, Somalis, Sudanese, the Burmese, Liberians, the Bhutanese, Iraqis, the Syrians, and the Congolese. Felicia graduated from Villanova University, the Yale University Divinity School, and the University of Connecticut School of Social Work. But she says her best education has come from her amazing staff and the refugees that she works with every day. Lastly, we have Haji Adan. Haji is the executive director of the Refugees and Immigrant Self-Empowerment Program. Haji comes from Somalia, where he spent 17 years living in a refugee camp. This experience only heightened his desire to assist and to empower refugees and immigrants in the Syracuse community. Haji has done an outstanding job in directing his organization, where he took a struggling organization to where it now has a $1.4 million budget. In addition to working a full-time job, Haji graduated from OCC, and in 2012, he was named the Leader of the Year by the Central New York Community Foundation. And so to these panelists, we say welcome and thank you very much.
Do we want to start with Marwah?
Yes, we'll start with Marwah.
Yeah, thank you. Thank you for having us today, and thank you for your Father Jim for your nice introduction. So yeah, my name is Marwah Alobaidi, and I am the Associate Director for Resettlement Services at Interfaith Works, Center for New Americans. And for those who don't know, Interfaith Works has been around since 1976. It's a nonprofit organization, and our mission is through education, service, and dialogue, affirm the dignity of each person and every faith community, and works to create relationships and understanding among us. So the Center for New Americans is one of many programs that runs within Interfaith Works. We provide resettlement services for refugees who forced to flee their country because of war, violence, or persecutions. The center provides many services, including from picking up the family, welcoming them in the airport until the family reach their the goal, which is self-sufficiency. Within the too many services that we provide, one of them is within the many of them is employment preparation, medical case management, mental health services, culture orientation, immigration services, referral, and community navigation service. I will leave the website, the link for our website in the chat box for those who like to read more about our programs. And I will turn it to my colleague, Felicien Seruhungu, who can talk more about our response and service during COVID. Thank you.
Hi, everybody. Can you hear me?
Yes.
Yes.
Can you hear me, please?
Yes.
Don't know how to do it.
Must be that must be Felicien.
Can you hear me?
Yes.
Can you hear me now?
Yes.
Thank you so much. As you mentioned, my name is Felicien. I have been in this country almost 12 years. So let's talk a little bit about COVID and what our agency has been doing since COVID happened. This is almost over a year. As we all know, the COVID-19 has taken the world by storm and has caused havoc everywhere. Hundreds of thousands have died worldwide, and millions have been infected, and the infection rate continue to rise. It would not be an overstatement to say that the COVID has changed our lives forever. As COVID has made our lives difficult, it has made the lives of new Americans even worse. As new Americans try to navigate the language and culture barrier, they now must deal with a global pandemic, and this combination of obstacles has made their lives more difficult. Our agency, Interfaith Works, had to quickly adapt to the increasing needs of our clients, which include education about COVID-19, outreach to assess needs, support for those who tested positive for COVID, and providing technologies needed for school purposes. Education about COVID-19. We at Interfaith Works quickly realized the seriousness of the disease and had to make sure that our client of New American were on the board with the death of the USA population. We did this by first identifying the diversity of our client population to understand the many languages spoken. Once was established, we worked to identify the best language translators in each of the language. These translators were carefully selected and had to be proficient in both the English language and as well as the said language. Once the translators were selected, we decided to create COVID outreach videos where the Center for Disease Control guidelines on the best practices to avoid COVID-19 were translated to the respective language. The most important part of the guidelines that we conveyed to our client is that, as always, wearing a mask and social distancing, staying at least 6 feet away from the closest individual. Additionally, our clients were educated on the importance of not holding social gatherings and staying put at home when they don't need to get out. So they were also taught how the risks of COVID-19 can be minimized by simply washing hands frequently and not touching face. The videos were then distributed by the agents to each respective community. Outreach to assess needs. COVID-19 led to many of our clients, or New American, if I can tell that, being unemployed as well as was the case across the country for that matter. So this meant that our clients were struggling to make ends meet and were struggling to pay the monthly rent. Interfaith Works as team worked hard to make sure that our client had food on the table to feed their families. Furthermore, we worked hard to make sure that no one of our clients were being evicted from their homes because they couldn't afford them. So what we did as team at Interfaith Works, we have a big team. We worked hard to make sure that all our clients who has been who lost the job because of COVID, we helped them to get an employment benefit. We were able to help over 50 families, over 50 families were able to get in employment, and that it was not easy, but we did as team and we were able to overcome that issue. Support for those who tested positive. Although we did everything we can with our COVID-19 education outreach in hopes of preventing this disease from reaching our client population, the inevitable happened and some of our clients, unfortunately, were infected. So for those who were infected, we worked hard to make sure that they were adhering to the Center for Disease Control and the local health department guidelines. The most important part is that they would quarantine for at least 14 days and now leave the house for any reason, whatever. So this was a challenge for individuals living alone or living with young children who are not capable of learning or to go to store shopping. So this is where Interfaith worked hard in delivering food, medication to our clients infected by COVID. So we were able to provide any kind of food, milk, it was food. So this has been anyone who got sick, we were able to provide food and milk, even medication, and sanitizer as well. So for school, providing technologies for school, classes have shifted online, as we all know, and the children of New American are at a greater disadvantage, as we all know, of performing well academically. Based on my own observation and my knowledge of the New American population we serve, I can say that many of them, if not all, did not have the technology needed at home for their children to stay enrolled in school through a pandemic such as COVID-19. So we worked hard to make sure that all school-age children of New American who were enrolled in school prior to the shutdown had to technologies needed in their home to stay enrolled and succeed. And not only we provided them laptop, but also we did our best to go and show them, because most of them, the parents, most of them didn't go to school, they didn't have a laptop, they didn't know even how to use them. We provided laptop, and also we went to show them how they have to use it. And what else we did? Some of them didn't even have internet. We paid them internet so that they can have access to the computer to laptop, they can use it easily. So all that has been done by Interfaith Works. So we were able to help more than over a couple hundred children and training them how they can use a laptop. So it wasn't easy, but I can say today that we did succeed to do that, even though it wasn't easy task for them, and training them. It is not once, it went twice, but we went many times to visit them, to make sure what's going on, to give them a call, to find out if they are able to use the laptop, if they do follow. So I can say that today, 100%, we can say 80% today, our New American kids are able now to use laptop. As I conclude, I don't want to take too much time. So COVID-19 has caused destruction worldwide. It has destroyed economies and has unfortunately killed hundreds of thousands of people. For New American, COVID-19 has caused great anxiety since this population had already other obstacles such as the language and the culture barrier. During this pandemic, we at Interfaith worked hard to make sure that our New American client had all the necessary resources needed to survive this pandemic. We are still working to educate them, and we are still helping them up to now, but the big job has been done, and today we can be proud saying that, yes, we did a great job, and they do recognize that Interfaith has done a great job. We have testimony from them saying that. So without taking too much time, let me say thank you so much. If any question, we'll come back later. Thank you.
Thank you, Felicien. Felicia, are you up next, I think?
Hi, everyone. So listening to Felicien and Marwah, I have to say that that's an impressive amount of work. And I also know that Catholic Charities did many of the same things. And I know RISE did many of the same things. And I think what strikes me is that, and I've always thought about during this pandemic, is that refugees are often served by agencies, and many people in the community are connected to community centers or churches who did many of the same things we did, made videos, did outreach to the community, gave out masks, helped people who tested positive. And I think what I am worried about during this pandemic and continue to worry about are the people that are not connected to a community center or a group who can do all of this fantastic support for them. The people who don't have those connections in the community, I think, are the ones that have really suffered through this pandemic. But I want to mention, I want to talk about a little bit about things that surprised me when the pandemic started and what really kind of caught me off guard. And the first was the digital divide. Boy, I never thought about the digital divide before. I knew there was a digital divide. I knew there was inequity in terms of who had computers and who had internet access, but it never ever struck me so much as when this pandemic started, because it started so fast. So within a few days, we had to figure out how we were going to communicate with people, with our clients. And we also had to figure out how kids were going to go to school remotely. And I think where we started is we thought, okay, if we can just get every family a computer. So that was our first goal. Let's get every family a computer. If they just have one computer, they can share, and that will be something. But then we had to think about, well, do they have internet access? So sometimes we had to go out and get internet access. We very quickly learned that one computer per family is not enough. And I think by the time school started in the fall, the requirement had become every school-age child had to have a computer. And we really learned from this the importance of keeping families connected, and this technology that we sort of all take for granted, and we really hadn't realized was so lacking in the refugee communities. This was something we knew we had to focus on for the future. So happily, I think that this is something the National Refugee Resettlement agencies and the State Department have learned as well. So I know for newly arriving refugees in 2021 and probably beyond, every school-age child will get a computer. So that's a great resource that we never had before. So that's something really good. The other thing that surprised me is we were approached immediately by people in the county and people in the community saying, the refugees are a very vulnerable population. We know that there's going to be widespread COVID infection in the refugee communities. What are we going to do? How are we going to get to these people? How are we going to tell them to keep themselves safe? We were doing lots of things to tell them to keep themselves safe. But what we found out is that the refugee communities were keeping themselves safe. The rate of infection was very low. When there were infections in the communities, they were coming from their work, usually. So that particular factories or places of work were having outbreaks, and then that was bringing infection back to the community. But we were really impressed overall by how well the refugee communities knew how to stay safe. They knew to wear masks, they knew to stay indoors, they knew to avoid large gatherings. And it hasn't always been perfect, but of course it hasn't been perfect in any community, as we know. But in the beginning, they were really showing lower rates of infection than the general population. And on Tuesdays at CYO, we actually do COVID testing for foreign-born individuals. and our rates of infection were below the county's rates. So we were really impressed, I think, with what we saw in the community as great resilience and also great support for one another. So they were getting the message out to one another and they were staying really safe. So that's my message of surprises. I think I'll turn it over to Haji.
Technology. So, all right. Hello, hi. My name is Haji Adan, and I think I was already introduced, so no need to go back there. So, following what everyone has said, every organization, the most surprising thing, right? That when COVID happened, every single organization that serves the New American community, especially Catholic Charities, Interfaith Works, and Rise, how we were able to quickly figure out a way to collaborate information. Information that I get from the county, I would be able to send to Felicien and Felicia and Interfaith Works, and then them sharing with us the information that they have and all those kind of stuff. So the thing is, when COVID happened, as everyone said, every organization struggled. Where do you want to begin this thing, and how are you able to continue helping your clients, right? And so Rise was fortunate enough to create 24/7 hotline that translated to connected to the staff members that work for the organization already, about I can say about 15 different languages. So which was helpful. The city school district, the county, and health department was actually using our 24/7 line to connect to families who are infected with COVID, or otherwise if they needed to drop off paperwork or something like that. And even the police department was using it. So as everyone said, so distribution of the digital divide was also something that was there that we didn't knew exactly what's happening. So, but we were also, just like Catholic Charities and Interfaith Works, able to give out laptops to 65 families, laptops. So like distribution of PPE, milk, and all those kind of funny stuff. So, Felicia just, she was surprised to see how the New American community's infection rate was so low. And I think it is due to the matter that many of the New American community faced similar kind of outbreak, disease outbreak in their home countries or otherwise in refugee camps. Like, for example, where I come from, in the Dadaab refugee camp, there was always cholera outbreak, malaria outbreak, and it's, all those other diseases. And then they get used to figuring out the best way to protect themselves and their family from those kind of things. So when COVID happened, for me as a former refugee myself, I thought that was going to be an easy thing for us to stay safe, just because we already had that experiences. But again, the other factor was that, even though every family member was staying at home, there was also this reflection of, oh my God, I never thought this thing can happen also in America. And then it will also take a while for America to find medication for this thing happen, because how everyone thinks America, at the click of a button, they can fix anything and all this kind of stuff, right? That was the question. And COVID happened, why they're not actually coming up with medicines to treat these things and all that, and also, losing their, jobs and all this, because that brought up, some mental health things that bring into their families and all this kind of stuff. So Rice was able to, because of me being a former refugee myself and leading the organization, so we decided to continue to stay open our office at a less scaled staff member, so that we are always there for our clients in case they need support, whether it becomes applying for food stamp or public assistance, or otherwise apply for jobs or unemployment benefits. So for me, like, it was very hard for me to close the office, because I knew some families don't even have the connection, just like Felicia said, to a center. You know, there are some people who are not already connected to a center. So, but if they hear, oh, that place is helping, so those kind of people will easily come and walk to our door. But by making sure that we are socially distanced and using face masks and all that. But I'm also so proud of the community that we live in. You know, so standing up for the New American community. You know, when we said we needed PPE, face masks and all that, it was so, you know, I was so happy to see many of people donated face masks, cloth face masks, and also the other ones, saying that you can give to your clients and all this kind of stuff. So I thought, in general, not only the refugee serving organizations, but the whole community of Syracuse was able to recognize that there was a need, and they stood up for the resettlement agencies and agencies like us who are actually serving the New American community. And even also, it was also a learning moment, I think, for the county, the hospitals, and everyone to realize that these are the connection problems when it comes to serving the New American community. So when it became too difficult for them, reaching out to us and organizations like RISE, Catholic Charities, and Interfaith Works, asking for guidance and help. Like, you know, like Felicia, with our connections with Upstate Medical University, figuring out how we can equally distribute vaccines, you know, how can we, you know, those kind of things. That's like a communication now that is started up. It used to be here and there, but now we feel like there's a connection. The hospitals and the county and is willing and ready to actually work with the service providers, so and looking up to us for guidance. So and that's something something that I thought was actually eye-opening for all of us. And I'm so proud to be living in the city of Syracuse, where there are a lot of kind people that are willing to work together.
Thank you. Thank you to all of our panelists. I think it's time for us to go through some questions. Brian, I'm going to turn it over to you.
Thanks, Rita. I'm Brian Hoke, a volunteer here at Focus. I'll add my thanks to everybody who's joined us today, in particular, our panelists, not just for sharing your thoughts today, but all the work you do in the community. We have a series of questions that we've received from the community, and I'll direct them most of the time to one of our panelists, but please, by all means, any of you feel free to share your thoughts, including you, Father. First up, we had someone ask, given the change in American political climate, right? The president, Congress, especially the Senate, has changed in just recent days. Do you expect to see more new refugees and immigrants coming into our community? And do your agencies have the capacity to serve them? Felicia, do you want to take that one?
Yeah, sure. So yes, with the new presidency, we do expect to see more refugees coming, something we're really excited about. What we have heard from the State Department is that they think they can bring in about 30,000 refugees into the United States this fiscal year. So the fiscal year started in October already. So we're already well into the fiscal year. We don't expect to see those new arrivals until the second half of the fiscal year, and maybe even late into the fiscal year. But I think it's a really good sign that they think, even if they only have half the fiscal year to work with, they can bring in 30,000 refugees into the United States. After that, we expect that the presidential determinations will be much higher. President Biden has said that he wants to set the presidential determination at 125,000, which would be fantastic. We were close to 100,000 the last year that Obama was president. So we're really looking forward to things starting up again very quickly. And we have held firm for the past 4 years. Interfaith and Catholic Charities have done everything we can to stay intact and ready for change. So we feel like we're ready to move when refugees start to move.
Great, thank you. Anybody else want to chime in on that one? All right, we have another question sent in advance. Marwah, if I can address this one to you. What has been the biggest challenge for the immigrant and refugee community with regard specifically to COVID?
Yeah, so in the beginning, the biggest challenge that we noticed, it's the inconstant message that was going around between the county, the information from the World Health Organization, CDC, wear a mask, do not wear a mask, sanitize your grocery, do not sanitize your grocery. The virus live for that X amount of hours. Then like the inconstant message create some untrust environment within some population. It's allow to have some myth and some false information to go around. So, and one of the biggest things is people were scared to go to the hospital. Some people they were untrust, like they feel not to trust to go to hospital and be treated there. So it creates more outreach for us that we need to do more education. So we reach to the leaders of these communities, we reach to the pastors from the churches that they visit, we talk to them because they really listen to them, they trust them. So which is, we notice later, it's straighten out better, like people start like saying, yes, I am positive, I want to go to the hospital, I need help, which is in the beginning was really like a concern for them. So that's what I saw on my side.
Sounds like those connections that you forged with members of the community and leaders in churches paid off.
Yeah.
Anyone else want to comment on that? Okay. Felicia, given the need to continue social distancing, certainly for some time to come, what have you found to be the best, most reliable method for disseminating health and/or COVID-19 related information?
Well, this is something new I learned during the pandemic as well. I learned that lots of refugees use WhatsApp. So we put out our videos about COVID on WhatsApp initially, and then have also used over time, we've taught people to use Zoom, which is a challenge when you have to teach everything remotely. We also have had people tell us that Facebook is the preferred social media platform. So WhatsApp and Facebook is really how we've been reaching people throughout the pandemic and how we've been disseminating information and educational information. So my fellow panelists, maybe you've used other things, but those are our big three: Zoom, Facebook, and WhatsApp.
Gotcha. Thank you. And I guess, sorry, go ahead, please.
Yeah, and I think it's the same, and that was the best session, actually, also connecting to their community key leaders, because every ethnic community have their own one respected community leader, making sure that those people have the right information so that they can share it with their fellow ethnic communities.
Gotcha. Thank you. Anybody else? All right, I have some questions on vaccines. Felicia, do you believe that vaccine hesitancy may be a concern in particular for new Americans, as hopefully we get vaccines made more and more available to the general public?
Yes, I think it's a big concern, and it's certainly one that's been expressed to me by members of the refugee community and even by our former refugees who are staff people here now. There's a lot of hesitancy around the vaccine. There's a lot of misinformation out there that people are listening to. And so that's a big challenge for us right now, is to get the word out that the vaccines are safe, and that we really want people to take it. And this isn't just the refugee community. Actually, in our testing on Tuesdays, we do a questionnaire, and the questionnaire has become a questionnaire on vaccines and whether people would take it. And right now we're seeing about 68% of refugees who are coming for testing saying they would take the vaccine if it was available. And that pretty much is the same as the general population, I think. I think even upstate only had, complete agreement from about 60-some% of their staff. So it's not just the refugee community, but the refugee communities are hesitant from what we've seen.
And as you say, mirrors what we see elsewhere in the more general population. Do you, Felicia, have any experience with vaccination programs in the past, other vaccination programs?
No, no, I don't have experience with other vaccination programs. I think the last one I remember I was about 4, but so maybe some of the others do. I know that we are hoping to bring a vaccination clinic to Northside CYO, just the way we do testing here. And I know that that's been a recommendation from the Health Equity Task Force on vaccines that Upstate is running, that they bring the vaccines out to the community, that instead of having them all at the fairgrounds, they bring them to community sites, whether that be churches or neighborhood centers. And it's something that they're doing in New York City. We learned yesterday already, they've set up community sites at churches and various centers, and that's being very successful.
Gotcha. Anybody else want to comment? Did I interrupt?
Yeah, I wanted to say, this, yes, vaccine hesitancy in the New American community. The thing is, like, there are 2 things, before we even come to America that's already in our head, like, right? The hospital for they'll take your kidney, they'll do all of this, they test and they use the New Americans or others low-income families, as a test to produce medicine or something like that, right? Or I'll be rich, I'll have this. So, and that will still stay there, but I think over time, people are learning based on that vaccines are important because, now they learn that their kids can't go to school until they have to have this kind of things when you're going through the immigration. So it will take a time. It will be, but again, this hesitancy, I will be the last person to take. I want to see how everyone else reacts. So they want to see one person tests that, and then because of that word of mouth, then they will use that as a judgment whether or not they can take.
Mm-hmm.
Gotcha. All right, thank you.
Yeah, I want to add just one word. Last time I was on meeting with my community, and I was telling some of them, please, the vaccine is now ready. Start going to get the vaccine, and many places now is available. And I say, you know what? No, we are not willing to go. You know what? This is anti-caste. They call it a 663 number. Some people who are Christian, they know what is about. At 666, this is about that vaccine. So we don't want to go get that. And they said, we have one way to you and see if the day you will get it, and then come tell us what your body will, how you will feel. So it doesn't come quick as we may think. Time of COVID, they didn't believe that COVID exists. We've been training them, letting them about this sickness, and even using leaders of the community. By leaders, I see pastors or president of communities. It wasn't easy, but today, most of them are now aware about this sickness. Most of people are now aware about COVID. They do accept, they do believe it exists. So it will be the same thing for the vaccine. It doesn't come just quick to accept and go get it, but step by step, they will realize that they need to get it as well.
Thank you.
Yeah.
Felicien, sticking with you, we have a question that a audience member sent in. Do you expect to play a role in locating illegal immigrants so they can be vaccinated with no repercussions? And if so, how would you approach this?
Well, first, at Interfaith, we don't work with illegal immigrants. We don't work with them.
Okay.
But what I've seen last year or last administration, Trump administration, did a great damage to the so-called illegal immigrant by hunting them down across the country and throwing them in jail, and some of them were even deported them back to their broken countries. So as a result, I can say there is a lack of trust between these illegal and the government or the government. But as let me say personally, I encourage the population we save to get the COVID-19. And one way to reach the illegal is by the immigrant, because they know each other, they communicate each other, they have a group each other. So through them, we can be able to know those so-called illegal immigrant or those who don't have paperwork. And we don't want anyone to be left outside. We want everybody to get this vaccine. But that should be the best way to reach them, by using as an immigrant, because they know each other and they can benefit from that. But the issue is a lack of trust. So trust, but I'm thinking with the new government, I meant Biden administration, I'm sure it will be tolerated for those illegal, and hopefully they will trust the new government and they can come and be vaccinated as well.
Gotcha. Thank you. We do have a note in the chat from a audience member. We love to encourage the use of the term undocumented rather than illegal. And thank you for sharing that. Just wanted to highlight that. A few questions. We don't have too much more time, but I'll go through these quickly. The next set are on education. Felicien, if I can direct this to you.
Yes.
How able are the families that you serve to help their children attend classes, which of course mostly or often, not mostly, but often now virtual? Has that been a challenge?
Yeah, it has been a challenge. As we said, the first time it was a big challenge. As I said, they didn't have any technology. They didn't have a laptop. They didn't have a internet in the house. So as agency, we noticed this at the first time, and this is what we were able to do the first thing. And we did provide the internet, a laptop, and now that was the first thing that we did to make sure that they do have those documents. I mean, those laptop and the internet. And I can say that today they are able to use it, even though it's still a challenge for some of them, but it is not like before. Even though parents, most of them did go to school, they are not able to help their kids. As you know, parents are doing a great job to participate in the education of their children. But imagine someone who didn't go to school, what role is he going to play? It is not easy. But at least there is a minimum percent I can say that kids are attending, even though it's not at 100%. But there is anyway something they're learning.
Gotcha. Thank you.
So
Mark,
I wanted.
I'm sorry. Please, go ahead.
I wanted to add.
Sorry. Go ahead, Haji.
Oh, okay. So I wanted to add that that has been a big challenge, and I do know our organization was able to. We had 150 kids who were enrolled into our after-school program. And beyond giving them computers, we were able to continue doing their after-school program homework help via Zoom. So we bought a lot of Zoom licenses and we also recruited a lot of students from Syracuse University, Lemoyne, and even outside colleges outside of New York who were interested to actually help the New American community. So in that families don't even speak in their own language. So, I mean, don't write and read in their own language also. So in technology, even for us, sometimes we run into that problem, even in the office, right? So, but again, families realized, and the new Americans, their hopes and dreams are on their children, because they always want the best for their kids. And they say, I came to America, one, for my safety, two, to educate you. So, and for them, education is a priority. So they're trying everything they can. But again, is that sufficient? No. There are some families, some kids who are struggling, who are lagging behind in school, in classes. I do not, because for me, even myself, as a father myself, who have kids in the school district, I know the different challenges kids bring. I'm able to help my kids. But there are a lot of families, like my father, like my brother, my uncle. When I go to their house, their kids are not the same as my kids when it comes to attending school and all those kind of stuff. So it's a big challenge. The barrier is there. But I do also know that there are a lot of other communities, organizations, that are actually trying their best to make sure they reach out to the kids and help them.
Gotcha. Thank you. Marwah, did you want to come in on that?
Yeah, I just wanted to add, the opportunity that we were able to provide all of these technology where there was a big help from the community who thought about the new American, who reached out to us and who made all of these donations. So there were so many people who donated specifically for these students, and they were thought about then, and we were able to secure another grants to so we can cover more people to have this remote education.
Gotcha.
Yeah.
Thank you. Well, I see we're very close to time. I apologize that we didn't get to all the questions that folks had sent in, nor some of them that folks had put in the chat, but certainly I'll add, again, my thanks to everybody for your thought. Rita, I'll turn it back to you.
Father Jim, did you have any closing remarks you wanted to make?
I just have a question, and that is, I'm wondering if Felicia and Haji ever lost hope living in the refugee camp.
Okay. Yes. Every other year I go back to the refugee camp that I came from, and looking at it and seeing the number of refugees that still live there and the struggles and challenges that they have, and then looking back at when I was there, system that I used to have for them in the app is maybe the second now, largest refugee camp, and the support that they get from UN is actually their efforts, and everything has been taken to other parts of the world, like the Syrian crisis and those other part of the world. So every single one of them have a hope that one day that they will come to America. And that's the question they say. It's funny how they know everything. Oh yeah, they even call us and just feeling. When the pandemic had the phone call, how did you end up? Oh, are you okay? Is the family safe? Are you okay? And then we had that president, right? And every time, oh, your president just said this. Oh yeah, I just wake up. When did you come to know what's happening in my country, right? So they were worried for us in our COVID time. So I did not lose hope on those people. Hopefully one day they will be either in Europe or other somewhere in America.
Yeah, thank you.
And any other comments on that, Felicien?
Yeah, I wanna just add about what Haji said. Yeah, I've been here over 10 years, and the refugee camp where I was in is still there, and many people are still in refugee camp. And those people who live there, they don't have any hope of life. They live like a cow, sleeping at night without having hope of what they will eat tomorrow. And the only hope they have is to come to this country, to this wonderful country, which is USA. And there is no hope. Back home is those who are following what is going on in most of African countries. Those people are in politics, they do fight each other, they do kill each other on position, fighting for their own interest, not for the people. So those small people are fleeing and going to refugee camps so they can stay there. But the only hope they have is to come to this wonderful country. So all this year, Trump has been in White House. There was we can count how many people were able to come. We received few refugees, we received few people, and even though they've been, we are in touch with them. They've been asking when Trump is he leaving, when Trump is he leaving, because their hope is here. And we know that we, USA, in this country, we have a room for them. We have empty places where those people can come and feed and cover. They do great job. We have great people who are doing businesses. They came from zero, but today they are on top. Today they have their own houses, their own businesses, their own restaurant. Those people, they do contribute to American economy. So we still need them. They are dead. They don't have any hope, but the hope is here. They are waiting to open the door. We hope with the new administration, we may get a big number. So we need them. They can come and contribute to the American economy.
Thank you.
Yeah.
Thank you. I'm sorry we've run out of time, but I do really want to thank our panelists, Haji, Marwah, Felicia, and Felicien, for sharing your experience and expertise, and Father Jim for moderating. Thank you so much. I hope this has been an enlightening experience for everyone. We'll be posting this forum on the Focus website shortly, focussyracuse.org. So if you know of anybody else who would like to view what we've just seen, please share that with them. Also, please tune in to our free virtual Wisdom Keeper event next Wednesday, January 27th at 5:30. This year, we're honoring the whole Central New York community for service, resilience, and innovation in the face of COVID. During this event, we'll hear from several individuals on their positive reflections of their experiences this past year, as well as from Mayor Walsh and County Executive Ryan. Please check for more information regarding this event on our website, focussyracuse.org. Thanks to everybody, and have a great day. Have a great weekend. Take care.
Thank you.
Bye.